Good morning, everyone. This is Chris Fox from Voices for Non-Opioid Choices. Thank you for being with us this morning. We're going to give folks just a minute or two to join us. So just as a friendly reminder, if you could please put your phones on mute to minimize any background noises, we would appreciate it. Also, you will see that there is a chat function in this meeting. And so if you have any questions for myself or General Price as we're making our remarks, please feel free to put a question in the chat box. At the very end of the presentation, there will be a moderated question and answer session. So we will call on folks at the very end if you don't want to type that in. But the easiest thing to do would be to enter your question in the chat function, and Reiko from CADCA will go ahead and ask the relevant questions. So again, this is Chris Fox. Thank you for being with us. We'll get started in about a minute. Okay, everyone, we want to be cognizant of people's time here this morning. I know everyone has busy schedules and other things that they want to or need to do with their day jobs. So we're going to go ahead and get started. Thank you so much for taking your time to be with us this morning. My name is Chris Fox. I'm the Executive Director of Voices for Non-Opioid Choices. And with us here this morning, we have our friends from CADCA, who are one of the founding partners of Voices for Non-Opioid Choices, which launched in May of 2019 around the shared belief that we can do more to prevent opioid addiction before it starts, including by increasing utilization and access to non-opioid approaches to help individuals manage their pain. What we know is that 3 million Americans every year go on to become newly persistent opioid users following some kind of an acute pain incident. And Voices and our partners believes that we can do better for these patients by increasing their utilization and access to non-opioid approaches, and in the process, stem rates of opioid addiction, overdose deaths, and opioid-related incidents that have been on the rise in recent years in this country. Before we get started, I'd like to introduce General Price, who's going to say a couple of remarks from CADCA's perspective, and then we can talk a little bit more about Voices' specific work, as well as some legislation that Voices has been working on. So for those of you who don't know, General Price joined CADCA as Chief Operating Officer in 2016 and just became CADCA's President and CEO in September of this year. He is a 1985 distinguished military graduate of the University of Houston's College of Business Administration. He earned a Master's of Arts degree in history in 1994 from Texas A&M University. And in 1997, he became the first African-American to obtain a doctorate degree from the Department of History in the 140-year history of Texas A&M University. He's also earned a Master of Science degree in National Security Strategy from the National Defense University, where he graduated in 2004. General Price served within the U.S. Army for 31 years with duty domestically and abroad. His military awards and decorations include the Distinguished Service Medal, Defense Superior Service Medal, 3 Legion of Merit, Bronze Star Medal, among others. Thank you, General Price, for being with us this morning, and I'll hand the microphone over to you.
Thank you so much for that wonderful introduction, Chris. My mother would be tremendously proud. So CADCA was founded in 1992 as a recommendation from the President's Drug Advisory Council. We represent more than 5,000 evidence-based multi-sectored coalitions nationally, and we've worked in more than 30 countries around the world. Our mission is to strengthen the capacity of community coalitions to create and maintain safe and healthy drug-free communities globally. According to the National Institute of Drug Abuse, NIDA, Misuse of tobacco, alcohol, and illicit drugs cost our nation more than $740 billion annually in crime, lost work productivity, and healthcare. We believe that prevention of substance use and misuse before it starts is the most cost effective and cost efficient way to reduce substance misuse and its associated costs. We know that $1 invested in prevention saves communities on average $2 to $20. You should know that CATCA supports the whole continuum of care from education to prevention to treatment and recovery, especially during the era of COVID-19, which is why we embrace the work that groups such as Voices for Non-Opioid Choices is doing. Our coalitions are on the forefront of prevention efforts in their communities and are making tremendous impact. During the COVID-19 pandemic, as many Americans are facing experiences of heightened stress and anxiety, as well as physical and social distancing, we know that our work to prevent substance use and misuse before it happens is even more important than ever. Research from our partners at NIDA and SAMHSA shows that people with substance use disorders are more likely to be susceptible to the effects of COVID-19 and may face additional struggles in maintaining sobriety while being physically separated from others. SAMHSA reports that 64.6% of misused prescription pain relievers in the past year were obtained from friends or relatives for free. This makes disposal pouches a critical instrument in addressing safely disposing of unused medications. That is why CATGOOD works with many partners throughout the field on prevention efforts. For example, we work with multiple corporate partners to distribute drug disposal and deactivation pouches across the country. To date, CATGA has distributed more than 1 million drug disposal and deactivation pouches over the last 3 years. Furthermore, we know that during this pandemic, doctors are once again overprescribing in an effort to reduce unnecessarily exposing their patients to the risk of catching the virus. These actions, though well-intended, increases the chances of substance use and misuse, thus creating the need for even more treatment and recovery resources. Our coalitions are beginning to see an increase in substance use disorders because of COVID. Due to COVID distancing practices, people are not able to access their doctors or recovery and treatment resources as needed. This is why our organization is committed to helping community coalitions sustain and thrive during this uncertain time, nationally and internationally. Given that CATCA has been able to maintain and even increase engagement with our coalitions during this pandemic, there is an opportunity to further develop strategic trainings and evidence-based recommendations for our coalitions through virtual platforms, which will help address the increasing risk of opioid misuse during this time. Although we are all having to adjust to a new normal in this challenging time, rest assured that we are here to provide assistance in any way possible as we work together to create safe, healthy, and drug-free communities globally. CATCA's continued partnership with Pacera Biosciences initiated a Non-Opioid Choices project, which aims to work with communities on advocating and strategizing for various non-opioid options available for acute pain management. Over the course of 18 months, 18 coalitions were recruited to begin an educational awareness campaign. Using CATCA's National Coalition Academy as a model, these coalitions took part in a training tailored to the needs of advanced coalitions. The training armed coalitions with knowledge regarding pain management options and non-opioid alternatives, ways to heighten key stakeholders' involvement and community understanding, tools to create messaging about the need for these options in their community, and strategies to engage healthcare providers and lawmakers on the importance of advocating to support these initiatives. Non-opioid choices are critical for the recovery community, but this project also works to address the issue upstream and prevent the onset of substance use disorder involving prescription medications. October is also National Medicine Abuse Awareness Month. Did you know 1 in 5 young adults has misused a prescription drug? National Medicine Abuse Awareness Month works to raise awareness of the dangers of over the counter cough medicine and prescription drug misuse. We work with our partners to develop and distribute helpful resources and materials during the month to assist in education efforts. Through the efforts of our organization and our network of community substance use and misuse prevention coalitions, we continue to make an impact both in person and virtually in making our community safe, healthy, and drug-free. And webinars such as this one we are on today help us to continue the conversation and continue our momentum. Thank you for having me today, Chris.
Thank you, General Price, for that very helpful overview. Now, if it's okay, I will go ahead and share my screen, and we can talk through a little bit more in a little bit more detail about some of the information that we just referenced there. So as some of you know, the COVID-19 crisis has had a direct impact on a lot of health conditions in the United States. And the opioid addiction epidemic is obviously not immune to that. General Price talked a little bit about what the added stress of the pandemic, mental health incidents are on the rise, incidents of depression, as well as isolation and fear have led to some increases in drug abuse in certain communities and among certain individuals. Some estimates, including from the White House, have in fact estimated that month-over-month data comparing overdose deaths in 2019 to those so far in 2020 have shown that overdose deaths are actually 11.4% higher than they were in 2019 when nearly 71,000 Americans died from a drug-related overdose. To put that into context, that means that if current trends continue, that by the end of 2020, we'll have nearly 80,000 Americans who have died from a drug-related overdose. I think we want to talk a little bit about how the link between prescription opioid pills and overdose deaths. I think what we have seen recently with the increase in overdose deaths is that they are largely attributable to some of the illicit forms of opioids like heroin, fentanyl, and some of the other illicit opioids. What we want to understand is exactly how individuals begin using and abusing some of these illicit forms of opioids. And so it's not really surprising to us to understand that prescription opioids are often a gateway to utilization of more illicit forms of opioids. In fact, 8 in 10 heroin users have reported that they initiated opioid misuse via prescription pills. Other surveys show that this number might be as much as 90% of heroin users having reported also abusing prescription opioids. So what we see here is we see a very clear pattern of individuals who start abusing prescription opioid pills, can go on to abusing other illicit forms of opioids, and sometimes, unfortunately, pay the ultimate sacrifice. And we're seeing those obviously on the rise right now. What Voices is doing to combat this is we are promoting a piece of federal legislation called the No Pain Act. The No Pain Act stands for Non-Opioids Prevent Addiction in the Nation Act. And to General Price's point earlier, what the legislation is designed to do is to attack upstream and prevent opioid addiction before it starts by increasing the utilization of non-opioid approaches to acute pain management. It won't surprise a lot of folks on the call today, I'm sure, that there are some very specific barriers that get in the place of more fulsome utilization of non-opioids. Most of these barriers are limited to reimbursement for these therapies. By and large, non-opioid therapies are not reimbursed for patients in the acute care setting, whereas opioid treatments are seen as extremely economical because they are reimbursed fully and they are seen as cheap, especially when compared to a little bit more expensive non-opioid approaches. Unfortunately, these approaches, in our minds, have had the unintended impact of incentivizing providers to prescribe opioids to their patients. What we say is that this disincentive needs to be removed and that we need to do more to put all available pain management options on the table for providers and patients, to put everything on an equal economic footing and let providers, patients, caregivers, and loved ones figure out a pain plan that makes sense for them, that recognizes their family history and their relative risk for developing substance use disorder, and make an informed decision for themselves, for a loved one, or for somebody that they're caring for. And the No Pain Act would do exactly that, is it would put all available FDA-approved, safe, and effective non-opioid approaches on the table, and it would allow providers the opportunity to choose exactly how they want to, in conjunction with patient choice, deal with individual pain. Right now, the legislation has robust bipartisan bicameral support for it, including robust support in the third-party community from folks, everybody from AdvaMed to Bio to the Partnership to End Addiction, and to some acupuncture groups and some other therapeutic services like massage therapy and others. And on Capitol Hill, the legislation has the support of 50 members in the House of Representatives, as well as 19 senators. So the legislation has robust bipartisan support, and our hope is that Congress can work to get this legislation over the finish line, which would, in our estimation, increase access to non-opioid approaches and help prevent the 3 million Americans who go on to newly persistent opioid use following an acute pain incident. So if you are interested in learning more or hearing more about Voices or our work, we'd encourage you to visit our website at www.nonopioidchoices.org or email us at info@nonopioidchoices.org. Or follow us on our social media channels on Facebook or Twitter. But with that, I will stop and we will open it up for any questions that individuals might
Okay, so I am not seeing any questions coming in, but
Oh, I'm sorry. There are people using the hand raising option. I'm not sure if that's them wanting to speak out their questions or.
can they just put the questions into chat, please? Because we can't see anybody raising their hands.
Sherry and Marietta, if you guys are fine with putting your Q&A, or sorry, your questions in the Q&A box, that would be easiest for us. Thank you.
So we'll give them a couple minutes to type questions that they have. But in the interim, if individuals want to go ahead and put any questions they might have in the Q&A box, we'd be happy to answer them.
Okay, sure, we have. Are there any resources available if we want to talk to our local legislators?
I'm happy to talk about that. If you go to our website at nonopioidchoices.org, we do have a robust set of resources that are available to talk to your local members of Congress and senators. We also have information on there that is state-based, so it can be specific, so you can understand exactly what the current state of the opioid addiction epidemic is in your state, including take a look at prescribing patterns, overdose deaths, and some other specifics that might be interesting or relevant to you guys.
Yeah, and likewise, CATCA has tremendous resources for advocacy and teaching you not just how to speak to your legislators, but on the kinds of talking points that you should be engaging them upon. Likewise, if you attend our forum in February of each year, a major part of that is Capitol Hill Day, where we bring legislators to our venues, and they speak a panel discussion to those who are in attendance. And then we also schedule for you in-person meetings with those legislators and their staffers on Capitol Hill. And so though we won't be going to Capitol Hill this next February, we're going to hold that our forum virtually. We will continue to have Capitol Hill Day. We will continue to have that panel engagement, and where you can do Q&A with members of Congress. And we'll also have those appointments with legislators on Capitol Hill, both in the Senate and in the House.
That's great. Okay, thank you. We have another question, which is, how would you advise a person in recovery to advocate for non-opioids ahead of surgery? Does Voices have any recovery organizations in your membership that we can point our network to?
Of course, thank you for that question. So what I would say is the easiest thing to do is to ask a lot of questions. If you are a loved one or you're a patient yourself and you're considering undergoing surgery, I think the best thing to do is to ask a lot of questions before you go into surgery. Some of our members, including the National Patient Safety Council and others, have some resources about some questions that you should be asking. And a part of these questions should be about what approach your provider is planning to use to help you manage any planned discomfort after surgery, and what options you might have available to you should you not want to use non-opioids. We've heard from others who have done some shopping to make sure that they can have access, and so if one provider doesn't necessarily offer them access to non-opioids, that they've gone to other providers or other care settings where they may have had access to non-opioid approaches to help them manage their pain. So the best thing you can do is ask questions. There are resources that exist out there, including from the Patient Safety Council, about the types of questions. We're happy to provide those or point you in the right direction for some of those. But as far as your second question about other recovery organizations that we work closely with a number of recovery organizations as part of our everyday work at Voices. Some of these groups include folks like Young People in Recovery, Cover 2 Resources, Overdose Lifeline, the Will Bright Foundation, Aurora Sober Living, Hazel and Betty Ford Foundation. And, to be candid with you, we talk to some, if not weekly, then monthly, we're in touch with other organizations about how they might join forces with us to advance a common cause. So thank you for the question.
And I'd just like to add to that too, that as you engage with your doctor, if you know that you're having surgery, you should really go in to that conversation armed with options that you could have, that you could relate to your doctor, that this would be your preference, and they would certainly respect your wishes.
Great. General Price, we have a question. What would be a good resource to obtain the disposal prescription bags from a legitimate source?
Well, there's several options, and I tell you that you should really look at the science behind the bags. There are some that tout that they can deactivate drugs, but in reality they just encapsulate. And then there are others that actually deactivate the drug, and that's really what you're looking to do, is to make the drug inert. You can buy most disposable products online. You can buy them at Walmart. You can buy them on Amazon. You can even check in with your health departments, because many of them might have those resources on hand. Rico, I would ask if you could is just provide the list of cities that Rally has gone through, and they would list also places that might have those resources for free. But that's what I would advise.
Yep, absolutely. I'll just piggyback on that and say, if you contact us at CADCA, we can see if you're one of the states that we're working with, and we can probably get you some safe disposal pouches as well. We have a question. Senior abuse is on the rise. We believe there needs to be an education on not only use or misuse, but storage and disposal, since they can be contributors to use by family members. Do you provide that focus to our seniors?
I'll start, Chris. I tell you all that's a great question, and CATCA really tried to partnership with AARP a couple of years ago, and this is not designed to be a negative comment about AARP, but that was kind of a taboo subject, because they like to talk about the good things and the good benefits for our seniors. The free donuts at Dunkin' Donuts, the cheapened reduced cost trips on for airfare and cruises and the like. And so that wasn't a conversation that AARP was willing to take on. I could tell you that one of our partners, Verde, is engaging both the association that oversees healthcare facilities for seniors, with hospice, to recover those drugs that are left behind after somebody passes on as well. And then we're working, we as along with our advocacy group is working with legislation with Congress to address the same.
General Price, you mind if I just piggyback on that?
Please. Mhm.
I would also say you can get in touch with us at CADCA. We are working with one of our really long-term partners, Johnson & Johnson, and this year we're focusing on the mature audience, which we found out that that's what they like to be referred to, is the mature audience. And so we're really working this year to kind of really increase engagement of over-the-counter medicine use and misuse, really create some resources that will disseminate widely, but really focus on that population. So I would encourage you to get in touch with us and, see if we can get you involved in that way. Another thing is, we've learned during this time of COVID, the amazing, unbelievable work that our coalitions do every day. But one of the great ways that they are giving out the safe disposal pouches is they've actually partnered with their local Meals on Wheels, and when they're delivering their foods to our mature audiences, they're also delivering safe disposal doTERRA pouch. So really innovative partnerships like that. We're looking at that on a national scale. So I think those are some great ways, and you could get in touch with us at CADCA. We'd encourage you to as well. I think we have time. It's 10:27. We have time for one more question. So I will go ahead. I think here's a great one, Chris. How do we get in contact with our legislators? Do we email or call their offices?
Sure. It's a great question. If you go to our website at www.non-opioidchoices.org, there are opportunities directly on our website that can help get you in contact with your members of Congress and to weigh in directly with them so they can hear right from you. And the website will facilitate a letter that will be emailed into your members of Congress. And so you can go ahead and visit our website. There are materials and opportunities to engage directly right there through the website.
And as stated, we have direct communications with members of Congress, and through our forum, we guarantee you audience with your member's office during our forum as well. Rico, there was one question that I saw that popped up that I know we're growing close to the time, but it was a parent asked the question, how do you help your children during this period of isolation? And I think that's a great question. And as a parent, I tell you what I do is that we take walks, we go to parks, and we force ourselves to be in forum or in position where we are seeing other people. We're not really engaging those people, but we're seeing people, and it kind of has a feeling like that. I shared with Reiko Mendoza earlier today. We had a tasting for an event that we're going to have in a couple of weeks, and that was the first time in 7 months that I've sat at a table with somebody other than my family and had a meal, and just how phenomenal that spirit, that feeling was. I'm still on a high a couple of days later from that experience. And I think we have to force ourselves to get out, be safe, wear your mask, socially distance, wash your hands, but we don't have to be stuck and isolated in our homes during this time as well.
That's right. And to that point as well, General Price, a lot of meetings right now are taking place via Zoom with staff or members of Congress. And if you are interested in participating in any, Voices does these every day, every week still. And so if you're interested in sharing your story directly with staff from one of your local legislators, I'd encourage you to reach out to us. On the slide, there was an email address. It's just info@non-opioidchoices.org. And so if you're interested in speaking directly with your member of Congress or a member of his or her staff, please feel free to reach out, and we're happy to set up some time to chat about some of our shared interests. All right, so am looking at the clock and I see that we are at the end of our 30 minutes here. So I want to take just a quick second to say thank you to everybody who was with us here this morning. It was a great session. I hope you got some helpful information for you that informs your work that you do every day. Like I said, if you're interested in learning more, please feel free to visit our website. There are a lot of tools and resources available there. Reach out if you'd like to. We're happy to field any questions, concerns, or tie people in that way. But again, on behalf of myself, I want to, and the full members of Voices, our nearly 40 plus members, thank you, General Price and your team at CADCA for hosting this, for putting this together. It was terrific, and we hope that we can work on these issues together, because I think together we can have an impact, and we can, raise our voice, and we can make sure that our voice is heard by those in Congress who are making these decisions every day. So thank you for being with us. We hope you'll join us for the ride, and we'll talk to everybody soon, I hope. Hope everybody has a good day. Be well and be safe.